Today, graduated from Purdue's School of Nursing in 1998. The last 15 years have been spent working in emergency medicine. She is currently the Trauma Program Manager at Indiana University Health Arnett, the state's first American College of Surgeons verified Level 3 trauma center. She's going to tell us what being a Level 3 trauma center means and how a hospital earns that designation. Please give a warm Kiwanis welcome to Amanda Rardon.
Good afternoon. First of all, I'm honored to come and speak with you today. Thank you very much for the invitation. As Mr. Johnson said, I did graduate from Purdue. My best friend from nursing school and I were talking that it'll be 20 years next year. It seems like yesterday, until I went to campus last night, and then I remembered it was not yesterday. Very different. There's lots of buildings there now that weren't there 20 years ago. So my son said, "Why are you lost? You went here." I'm like, 20 years ago. This is all different. I was there when the bell tower was built, so that was kind of a fond memory. We walked out of Rent last night. We went and saw that, and the bell tower was playing, so that was nice. So I am the trauma program manager at IU Health Arnett. I am from the Monticello area. Grew up in Idaville, the big city. Tractor Pull, if you're familiar with the Idaville Tractor Pull. Yes, I run the kitchen there every year. Best food you'll have all summer. Grew up there, lived in Brookston for a little while, and my family and I now live in Burnettsville. We actually live in Carroll County, but we have a Burnettsville address. Right, thank you. Been in the area all my life. Always wanted to be an emergency room nurse. When I was in a car accident when I was a junior in high school, and then before that I couldn't decide if I wanted to be a teacher or a nurse, and that kind of made my decision. Every day now that I have teenagers, I'm thankful that I made that decision because I can medicate my patients, I can medicate the children. I'm kidding. I've been at IU Health Arnett since before we opened. We opened in October, and I started there in September. Helped open the emergency department. I worked in the old home hospital emergency department several years ago. That was my first stint as an ER nurse. That's where I grew up, where I learned how to do what I do. So when we opened our hospital, we decided that we wanted to provide preeminent care to the community. No matter what we did in our hospital, we wanted it to be the best care that we could give. So in that journey, we looked at the trauma system in the state of Indiana. And the trauma system in the state of Indiana is kind of an oxymoron because there is no trauma system. Before we became a Level 3 trauma center, we had two Level 1 trauma centers, which are your highest trauma centers, and they are incorporated with the university. So before, the only two Level 1 trauma centers that we have in the state are Methodist, which is, as we refer to at our hospital, as the mothership. They kind of guide us. And then we have Eskenazi, which used to be Wishard. They're actually right downtown together. And then we do have a Level 1 pediatric trauma center, which is Riley Hospital. So I was talking to Mr. Johnson about your relationship with Riley a little bit while we were having lunch. And Riley's close to my heart. My middle son is a Riley baby. So my oldest son is the captain of the dance marathon at Twin Lakes for Riley Hospital, so we've been doing lots of fundraising for Riley as well. And then we had some Level 2 trauma centers. We had a couple in Fort Wayne, we had a couple in South Bend, and we had a couple down in Evansville, and that was it. So if you looked at the trauma hospitals in the state of Indiana, we sat in a huge void where we're at in Lafayette. So what being a trauma center means, any hospital can take care of you if you're hurt, okay? So if you're in White County and you get hurt, you can go to the White County Hospital. They can take care of you and get you where you need to go. Being a trauma center means that we have an accrediting body, the American College of Surgeons, that comes in. We have what we call the Orange Book, and it's kind of our Bible that we follow to make sure that we meet all these criteria. They come in and they look at your criteria and they make sure that you're meeting them. And it's not an easy feat. It took me 3 years to get us verified as a Level 3 trauma center. We were the first in the state of Indiana to be verified by the American College of Surgeons, which was super exciting. So as a level 3 center, what that means is we can take any patient with any injury and we can get them stabilized. We may not be able to keep you in our facility forever to fix you completely, but we can get you stabilized and quickly get you to where you need to go. So an example of that was before we started doing the trauma center stuff out of the Orange Book, I looked back at some of our patients that we had previously, and some of our sickest patients that we had in our facility maybe stayed in our emergency room for 4 or 5 hours while we kind of waited to decide what we wanted to do. Once we became a trauma center, that same sick, horribly injured patient, we were able to get stabilized, have good vital signs, and get them to Methodist Hospital in less than an hour. So that's huge. That's a huge improvement. Another thing that happens now as a trauma center is that for those sickest and most hurt patients, there is a surgeon at your bedside in 30 minutes. So if you meet specific criteria as a trauma patient, you'll have a surgeon at the bedside in less than 30 minutes. And we have a 100% response rate for our surgeons. They have never missed a call, which is huge. We're required to have 80%, and we have 100. So that tells you the dedication that we have. I myself, like I said, I'm the trauma program manager, so I'm responsible for making sure that everything gets done and all those rules and requirements are followed. We have a trauma medical director who is Dr. Ruben Nermelin. He's one of the surgeons here in town. He's my medical director, and I tell him what to do, usually, is how that works. He likes to think it's the other way around, but it's not. And then we have to report all of our data to a state trauma registry. And so that is about 400 data points on each trauma patient that has to be entered into a registry. So I have 2 gals that help me out with that. One of the most exciting things for me as a trauma center, though, is the outreach that we get to do. And I know that as a club, you all are very focused on outreach as well. So that's very exciting to me. To be one of our requirements is that we have to do injury prevention and outreach to the community. So we have a few programs that we participate in. One thing we participate in is we give out free bicycle helmets. If you come into the emergency department and you're a child, you will probably leave with a bicycle helmet whether you want one or not. If you come to the emergency department as an adult and you've crashed your bike, you're going to leave with the bicycle helmet whether you want one or not. We had gotten a grant from our Arnett Foundation that supplies the money for bicycle helmets and also equestrian helmets. The gal that helps me do outreach, she's an avid horseback rider. So she has a huge outreach that she does all over the state of Indiana about helmet safety when you're out horseback riding, the importance of helmet safety, and we give out equestrian helmets as well. Unfortunately, equestrian helmets are quite a bit more expensive than bicycle helmets. So when we do equestrian outreaches, we're able to give away 1 or 2 helmets, and we're not able to give one to every child or adult that attends. But if we have somebody that we know is, really needs a helmet, can't really afford it, family can't afford it, we make sure that they get one. Also, if you come into our emergency department and you have had a horseback riding accident, we will supply you with a new helmet, because they're just like car seats. Once they've been in an accident, they're void. You need to throw them away and get a new one. So we make sure that if people really need one, that we are able to supply that. We also do a lot of outreach with our teenagers. Is anyone familiar with the Every 15 Minutes programs that they do in the high schools? It's about drunk and distracted driving. So we are very active in that program. Having 3 teenagers myself, that's pretty near and dear to my heart. So we're very active in that program. We allow them to come to our hospital. We will run the room just like they're a real patient. We allow them to videotape. We talk to the kids. We go to the convocations and things like that. We also are in the process of working on getting a drunk and distracted driving simulator, where it's kind of like a big video game, where we can take it out to the schools to let the kids use that and to really see what it's like. We have a pair of drunk goggles that we use for outreach that we let the adults and children put on, and you put them on. I put them on and dropped my pen and about fell out of my chair trying to pick it up. So they're pretty realistic, and It's very simple for health fairs. We'll put a piece of tape on the floor and we'll put those goggles on somebody and have them walk that line. And it's impossible. They just can't do it. So we do lots of outreach with that. And another outreach program that we do is to prevent falls at home. The number one injury on our trauma registry is elderly hip fractures. And so we do a lot of outreach for those types of things. For home safety, we go to the assisted living apartments and help with fall safety there. We work through our physicians' offices. We have lots and lots of resources on fall safety and what we can do to help prevent that from happening. And we've had really good, it's hard to keep data, as you know, on injury prevention and things like that. When you do your outreach, you know what you're starting with, but it's hard to prove that it's working. We've had really good outcomes with our falls prevention. And we've had good outcomes with our bicycle helmets, because I've been driving through town and I've seen kids with our helmets on. They're red and they say IU Arnett Foundation on the back, so I know where they got them, and so it works out really well. So it's nice to see that. We also do outreach with our EMS and fire departments as well. So we provide education for them for anything that, traumatic related. We also do medical education. We help with, heart attack education. We do chest pain stuff. We do stroke outreach, things like that with the fire and EMS services. I spend 3 days a quarter with Lafayette Fire Department doing EMS education with them. So they have, even though they're the fire department and they don't transport patients to the hospital, 80% of their runs that they get paged out on every year are medical runs. So we work with them closely to make sure that they're prepared when they get called as well. So are there questions? Usually there's lots of questions. So I'm happy to answer questions. Yes?
You talk about a surgeon being available within 30 minutes.
Mm-hmm.
How many surgeons are assigned to that hospital?
We have 4 surgeons, and they each have our on-call one day. There's one person on call each day. If they happen to be in surgery, then they call their partner to come to the hospital through the night. We have one surgeon that lives a little bit further away from the hospital, so if it's bad weather or he's a little concerned, he'll sleep at the hospital. That way, if the patient does come in, he's able to make that 30-minute time. Yes?
You have a helicopter pad and access to Indianapolis by helicopter?
Yes. Yes, we have, we actually have 2 aircraft in town. We have Lifeline, which is IU Health aircraft. It used to sit at the hospital on the helipad, but the maintenance costs were through the roof because it was exposed to the weather all year round. If it was going to ice, we had to fly it to the hangar. So they worked out a deal at Purdue, and so they are hangared at Purdue. It does not take them any more time to get to, actually I think they get to us faster now that they're across town than they did when they were sleeping down the hall. So, and then we also have PHI or Stat Flight, and they are also hangared at Purdue as well. So what happens is when we call for an aircraft, if our Lifeline aircraft is not available, say they're on another run or there's an issue, they will send us Stat Flight. They will send us the closest aircraft. We don't, they don't say, no, we're gonna have to wait and send another Lifeline from Muncie or whatever. They will send us the closest aircraft so that we can get the patient to Indianapolis as quickly as possible. Yes?
Do you pass out helmets to those who ride motorcycles?
We have not done motorcycles yet. That is a very good idea, very good question, and we've talked about it. The problem with motorcycle helmets is the expense and the fit, to make sure that you get the right fit. I would love to be able to do something where we could work with a company to get those helmets for motorcycle riders. I know there's a bill again, and at the state level to require helmet use for motorcyclists. There's also one for ATV riders. Right now there is no requirement to wear a helmet on an ATV, which being a country girl and growing up out there is terrifying to me. And I live in Carroll County, like I said, and we are one of the counties that actually allow ATV use on the county roads. And I live on a county road, and there are kids all the time zipping up and down our road without helmets on. And so, you know, we work really hard at the state level to try to get those bills passed, but it's very difficult. But that is something that we would love to do, but that's something that funding is kind of a barrier with. Bicycle helmets, if I order 500 bicycle helmets, I get them for $3 a piece. Yeah, so that's, you know, $3 a piece.
Okay.
The problem becomes storage. So of course in the winter I don't order a lot. In the summer, this time of year, I'll order 500 to 700 because we'll hand a lot out. We're going to Riverfest and several different places. So Carroll County has a kids' day at the Canal Park, and I'll haul a box down there and we'll hand out bicycle helmets down there. So, and we have them available, like I said, in the emergency department for any child that comes in, regardless of what they're in the emergency department for. They're in there for an earache, we still give them a bicycle helmet because we have that availability.
I'm curious about the Lifeline Crews. Obviously a pilot, or is it 2 pilots?
No, there's one pilot.
Repeat the question.
Oh, he was asking about the Lifeline Crews, about the makeup of the Lifeline crew. So Lifeline actually has 2 different crews. They have the adult and trauma crew, and then they have a pediatrics crew. So the adult crew is a pilot, and then you get a nurse, a paramedic, and sometimes a respiratory therapist, depending on if that respiratory therapist is gone with the pediatric crew.
My question then is, are they there with the helicopter
Yes.
24/7?
They are.
Okay, so
Yep.
are they like 8-hour crews or what?
24.
So they're on 24?
Yep. Now I know the pilots have different flight restrictions and hours, and I'm not exactly sure how they staff that, but the actual medical crew, they do 24-hour shifts.
Do they stay at Purdue?
They do. They stay right in the hangar. Yep.
Oh, that's something.
Yes.
Are you able to keep up with the drug addiction cases?
No. That's huge right now. Both hospitals are pretty much inundated with, especially heroin. We can tell when there is a new batch of heroin in town because our overdoses will skyrocket. But it's nothing to have 3 or 4 a week at our facility, and it's difficult. It's a difficult thing to fight because it's cheap. It's really inexpensive to purchase these drugs on the street right now, and so that's why the new law with the Narcan and being able to purchase that over the counter, and it's helpful, but is it the talk in the community is it just a Band-Aid? Are we just what do we need to do to really get to the heart of this issue? And we do have one of the gal that helps me with my outreach. She actually sits on the county overdose committee, where we have a committee that we meet and we're trying to figure out how can we fix this problem, because it's a tough one.
Look to Afghanistan. That's what.
How many repeats do you have on OD?
A lot. We had this month a gentleman that was in 3 times. Yeah.
At the outset, you mentioned level 1, level 2, and level 3 trauma centers. Just in general, what kind of differences are there?
Okay. So like I said, a level 1 is, they have an academic component. So to be a level 1 center, you have to be attached to a medical school. So Methodist and Eskenazi are both attached to IU School of Medicine. So they have to do so much research, and they have to publish so many papers and stuff like that. A level 2, basically, a level 1 also has a volume requirement. They have to admit a certain number of patients a year. A level 2 is very similar to a level 1, but there is no academic requirement. So there's no requirement to do the research and the publishing of the papers. And you can have a few things that you might not keep at your facility that you would have to transfer to a level 1. But it's pretty much the same as a level 1, except without the academic component. And then a level 3, which is what we are, is we have the capability to accept and stabilize and treat most things. But there are some things that we have to send to Indianapolis for a little more specialized care.
Can you give us examples?
So one of the big things is if you have an unstable pelvic fracture. So we see those a lot with car crashes where you're maybe entrapped in the car and they have to cut you out, or motorcycle crashes. We get them a ton with motorcycle crashes. They come off the motorcycle, they land on their hip or whatever, and it causes the pelvis to become unstable. We don't have physicians here that do that. So they have to go to Indianapolis. Now, we can get you stabilized, and sometimes you'll have to go to maybe interventional radiology, where we'll do some procedures to get the bleeding to stop, but to actually fix that fracture, you have to go to a specialist in Indianapolis. But for a lot of things, one thing I track very closely is our transfers and what we transfer and what we keep. And I make sure that what we keep is appropriate and that what we transfer is appropriate, to make sure that we are providing the best care that we can for the patient. Because, I would love to see us be able to not have to transfer anything, because like I said, when I was in school, I was in a car crash. I was flown to Methodist, and my parents had to drive from Monticello to Indianapolis every day to be with me. And I hate to see that for our community. I want to be able to keep everybody here and not have that 60-mile one-way drive that you would have to make to be with your family. So that's the goals. We're working there. Yes?
Interested in your perspective on emergency runs coming from West Lafayette to the ER. Are we a problem, or is it quick enough that it's not a concern for trauma care? Coming out of campus community or University Place, Westminster.
Right. So that's the big question. We look at that all the time. I sit on the TEAS board, the Tippecanoe Emergency Ambulance Service. I sit on the medical advisory committee for that, and we look at those run times a lot. We sponsor Purdue Fire, so I spend a lot of time with them. For the most part, they get patients to us very quickly. And they are able to, they are all advanced life support ambulances, so they're able to initiate life-saving care. They can put in a breathing tube, they can put in a chest tube, they can do those kinds of things that we need. The ones that we, worry about are people like Benton County and Carroll County, because they just really don't have anywhere to go. Like, we're the only place, because there is no hospital in Benton County and there is no hospital in Carroll County. So again, we sponsor both of those EMS services, so we work very closely with them. They have very broad protocols. They can do lots and lots of life-saving interventions on those patients, but that is something that we watch very closely. Since I've been in this position, we've added an additional ambulance to the county to run, because we had one ambulance that was just overwhelmed. Like, they literally just could not keep up. So we watch that very closely and make adjustments as needed, because I know it is a concern not having on this side of town a hospital. So we're very cognizant of that and watch that very closely.
With the expansion of the IU Med School on the Purdue campus, is there any potential for that impacting your level of certification?
Yes, I don't think in Lafayette that we would ever be able to be a level 1, only because of the volume requirement. There's just not quite enough. We joke because one of our requirements is outreach. So really what we're trying to do is put ourselves out of business, right? We're trying to keep people safe and not have to come to the trauma center. But I would love to be able to move us up to a level 2 trauma center. And we have had some talk about that. And yes, having the medical school expansion has been huge. We already we have family medicine and intensivist or ICU physician students coming through. We have lots of nursing students and paramedic students. We're already becoming really a great teaching facility. Yes?
The county decided it needs a needle exchange, but they can't decide where to put it. What is your opinion about the best location?
Oh, that's tough. Wow. I haven't really thought about it. I think it needs to be someplace safe where people feel like they could be safe to do it. I think that's the biggest thing. I don't think we could have it, just in a building in the middle of town. I think it would need to be some sort of facility, whether it be a hospital, a church, a community center, something like that, people would feel safe to be able to do that and to have the opportunity. Yes?
where did most of your overdoses come from? The northern part of Lafayette, the southern part of Lafayette, West Lafayette County? Or, I mean, can you tell me where?
It's pretty spread out. We do have several from downtown. But we have them, they pick them up in the parking lot at Walmart. It's just kind of, it's pretty sporadic. I mean, there are places, and spice is another big drug that we have an issue with. And, there's a couple places in town that's, if the EMS gets called there, that's pretty much what they're going for, is a spice or a heroin overdose. So, and the problem, with heroin, if we know they've overdosed on heroin, we can treat that. We know what the antidote to that is, and we can treat that. The problem with spices is spice is just a generic term. It's whatever they've decided to mix up that day, and so it's difficult for us to be able to treat that effectively. It's definitely an issue.
I love the question. What is your medical relationship with the Franciscan community? Do you have any kind of?
Oh yeah, we work together very well. I mean, we have to in this
We need to hear
facility.
that.
We work together very well. They are also level 3 trauma center. Regina Nuseba is the program manager over there. Her and I sit on state committees together. We are getting ready to put together a District 4 trauma task force where we'll pull in people from all over the district, from EMS and fire and places like that, so that we can really look at our trauma care and see where we need to improve on that. We have, if our hospital is at capacity, then we work with them and we transfer patients to them, and vice versa. If they're at capacity, they'll try to get them into us if we have beds, and so we work together really well. We have physicians that our neurosurgeons cover both hospitals. Some of our interventional cardiologists cover both hospitals, so we have a good working relationship.
I'm going to be really stupid here.
Well, that's all right.
Yeah. Is trauma center the new term for what we call emergency rooms?
No.
What's the difference?
So the emergency room is the emergency room, okay? So the emergency room is where it's the intake for the trauma center. So a trauma center, my job is I track the care of the patient from the time 911 is dialed until that patient gets out of my facility and goes to rehab or home or wherever that patient needs to be. So being a trauma center means that we focus on care from pre-hospital to the emergency department, to the operating room, to the ICU, to the med-surg floor, and then to their rehab. So we're responsible as a trauma center for that patient from the time the ambulance pulls up, or even before, to make sure that the ambulance is getting there in a timely manner and getting them to us until they are discharged from our facility. So my job is I not only look at the emergency room care, I make sure that when they went to surgery, they got the care they needed, they got the medications they needed, they got the surgery they needed. When they went to the ICU, we didn't develop any complications, we took care of what needed to be done, and that we get them in the place they need to go. So the emergency room is the emergency room. So the emergency room gets trauma, they get heart attacks, they get strokes, they get earaches. I mean, we get everything in the emergency room, but it's those patients that are injured by an outside force. So a car crash, a fall, a gunshot wound, things like that are the ones that we consider our trauma patients. That's a good question.
Question.
Yep.
Does Franciscan have their own helicopter also?
They are affiliated with Stafflight,
So how many helicopters are there here in this county?
2. And they're both hangared at Purdue.
So you all use the back and forth?
Yep.
Okay.
Whoever is available at the time will be the one that is sent.
So how do you decide whether you go to IU or to Franciscan? If you're hurt.
Okay, so first question was how many helicopters do we have in the county? We have 2. In St. Elizabeth, they have an affiliation with PHI or Stafflight because they are through St. Vincent. So St. Francis and St. Vincent kind of have a relationship. And then the other question was, how do you decide which helicopter? They'll call it whichever one is available.
Which hospital do you go to?
And then which hospital do you go to? So if you are awake and alert and you're able to talk to the EMS service, then you get to go where you request to go. So if you're in a car crash and you've got a bad broken leg, they will say to you, which hospital do you want to go to? If you are unconscious, then you're going to go to the closest facility, or if you can't make that decision. Now, if we have a mass casualty incident where we have multiple patients, 5 or 6 patients, they will try their hardest not to overload one facility, so they'll split those patients up. Obviously, they try to keep families together, but in order to not overwhelm one facility's resources, they'll try to split those patients up. But yeah, if you can't tell them where you want to go, then they'll take you to the closest facility.
You indicated that both hospitals operate frequently at near capacity.
Correct.
With the threat of a terrorist attack or an explosion in a factory that injures 50 or 60 people, what provisions are there for handling that kind of a sudden caseload?
Both hospitals have very detailed disaster management plans. So we would go into disaster mode. Part of that disaster plan is triage. So you have your green patients, which are your walking wounded. So in our facility, those patients would be sent to the ambulatory surgery center that we have there on our property. We would send a nurse and a physician over there to triage those patients. And then as they came in, we would just basically, part of that plan is that hospitalists and the admitting physicians kind of always know who could be discharged. And so we would work on getting those patients out the door so that we could get our patients in the emergency room back up into the hospital and get them taken care of. And that brings up another outreach that you made me think of that we're working on. So unfortunately, in our culture, we've seen lots of mass shootings and things like that. And, we want to think that it's not going to happen to us, but, we have Purdue. We have it's a perfect storm here in this community for something like that to happen. So the American College of Surgeons now has a campaign called Stop the Bleed. And it's where we go out and we teach teachers and store employees, how to stop the bleed, how to, if there is something like that, that they stop the bleeding. And there are kits that we put together that have tourniquets and gauze and things like that in it. And we're getting ready to, we, meaning myself and my outreach person and my trauma surgeons, are getting ready to go out into the community and start teaching this to schools and places like that, and place these kits in those areas so that we have those available for the teachers and the staff should we have the unfortunate event that would happen.
Okay, one more question, anyone?
Yeah, thanks, right. Okay, I don't know if you're aware or not, but now the standards for our military, and I'm talking National Guard, I'm talking Army Reserves, that 1 in 3 of those soldiers are taught triage, are taught to go ahead to IV. 1 in 3 NCOs are also taught that as well. So do you people plan, like what Roy was talking about, if we have a tornado come through here, that you understand where these people have been trained and
Yes.
can be of assistance to
Yes.
you to
Yes, absolutely. Everybody has a role. Not only do we have a disaster plan for our hospital, we have a county disaster plan and a District 4 disaster plan, and they all roll into each other. And we actually in April are getting ready, we'll have our big district-wide drill where we practice these scenarios. And usually the scenarios we practice aren't like there's been a tornado and there are 50 victims. Usually, it's like Armageddon. It's been a tornado, there's fires, there's chemical spills. I'm like, if it could go wrong, it could go wrong. And we practice what we would do with those. And then we have a debrief session where we all sit down and we talk about what went well, what could we do better, what could we do different. So we work very hard to make sure that we're prepared, especially for something like a tornado.
Thank you, Amanda. There's certainly lots to think of in community health care, and our admiration goes to the staffs of both hospitals and how hard they work to ensure good health care. Eventually, some donor is going to come up with a significant grant, and we're going to find a hospital on the west side, which will be a little more accessible to most of us. But until those days come, we're very, very pleased with the service that we have. Amanda here is a small token of our appreciation for your presentation today.